here's my audience. Here's my demonstration model. Hand off the camera. See me?
Mm-hmm.
Hi, my name is Kirsten Sensnick, and I'm a nurse at Lancaster General Hospital. Now, before I begin my presentation, I'd like to make sure everybody's feeling okay. Nobody's feeling nauseous or like they have to throw up. Because in my line of work, that might mean you need an nasogastric tube. Basically what an NG tube is a small tube that I can place down through your nose, down through your throat, and into your stomach to suck out your gastric contents. Sounds a little scary, right? I feel like as a medical professional, being educated and practicing this skill can allow everybody to be competent in the skill. And as a patient, understanding what goes into the procedure will allow for more comfort in case a patient were ever to need one. So today we're going to go through the preparation, the procedure itself, and then how to maintain an NG tube. So to start off, when you're preparing to place an NG tube, you need your supplies. You need gloves, the tube itself, lube, you need a syringe, your stethoscope, you need a suction canister, and suction tubing. Now, before you start the procedure, you want to explain to the patient, Kayla's my patient, that when I'm placing the tube, it may tickle a little bit, it may be a little uncomfortable, you may feel the need to cough or gag, but we're going to try and make it as quick and painless as possible. Now, before I start, I'm going to want to examine Kayla's nose and her mouth for any abnormalities. So we're going to look in her nose, and we're going to have her open her mouth. And basically what we're doing is we're seeing if there's any sort of abnormalities that would make it impossible to pass the tube, and we're also picking which nostril would be easiest to place the tube in, so whichever one's most open. Now it looks like Kayla's right nostril might be the best one, so that's what we're going to do, but then we have to pre-measure the tube. Now to pre-measure the tube, you're going to take the tube and you're going to start at Kayla's nose. I'm going to have to, Kayla, can you turn your head for me that way, just to show the camera? You're going to place the tube at the end of her nose and then go from her nose to her earlobe, and her earlobe to this bone right below her chest, which is called the xiphoid process. That just gives us a rough idea how far we need to place the tube so that it's properly placed. And then we want to mark that with a marker so that once we're placing the tube, we don't lose that line. So after we've done that, we want to position the patient in what's called a Fowler's position. Now Kayla's basically in it already. It's an upright, almost 90-degree position. And we want to explain to Kayla that when we're placing the tube, once we get to the back of her throat, we're going to have her tuck her chin down to her chest and take sips of water. This basically makes it easier for the tube to pass as she's swallowing. So now we're going to place the tube. We're going to take the tube and we're going to lubricate the end of it. And we're also, just a tip for when you're doing tubes to suction, is you want to put your syringe at the end of it. What this does basically is when you're placing a tube for suction, there's a lot of pressure possibly built up in the stomach. So if you don't have the syringe here, there's a chance that you're going to get gastric contents everywhere. So this will catch that. So we're going to place the tube on Kayla. Turn your head for me. We're going to send it down in through her nose. And once we get to the back of her throat, we're going to have her start to take sips of water and tuck her chin to her chest. So we're placing it, and as she's swallowing, we're going to push the tube further and further down until it's in her stomach. Now once it's in her stomach, let's say this is in Kayla's stomach right now, you're going to take your syringe off and empty out whatever gastric contents you've collected, and you're going to pull back 10 milliliters of air. Now you're going to attach your syringe again, and I'm going to have Kayla hold the tube there so we can simulate this. And you're going to take a listen right at that xiphoid process we talked about earlier. So right there you're going to place your stethoscope, and you're quickly going to squeeze your syringe. Now if the tube is placed properly, you're going to hear almost like a blowhorn or a whooshing type sound. It's basically an audible way of knowing that the tube is placed in the stomach. Now another way to do it would be to pull back on the syringe and try and pull out gastric contents and then test the pH of it. The pH will be 4 or less for gastric contents. So after we've done that, we are going to, I'm going to have Kayla hold the tube there again. We're going to tape the tube to Kayla's nose. So we're going to clean off her nose with alcohol. Switch that around. We're going to clean Kayla's nose off with alcohol. And we're just going to tape the tube to her nose. And we're going to tape around both sides of it. And then we're going to tape over top of her nose, just to keep the tube in place. Alright, and then once we're done with that, we're also going to pin the tube to the patient so that it allows it to stay secure when the patient's moving around in bed. Now, we've placed the tube, we've heard the 10 cc's of air, now we're going to flush the tube. So you're going to pull up 30 milliliters of water, and you're going to attach it to the end of your tube, and you're slowly going to push it in. That basically just makes sure the tube is working properly and that there's nothing clogging it and that it's getting into the stomach. So after we've done that, we are going to attach her. Now, I don't have suction present, so what you would do is you would attach her here to suction, the suction tubing, and then attach suction tubing to the suction canister on the wall, and you'd set it to whatever setting you'd have. In instances where you're not putting it to suction, if you're doing feeds through the tube, you need to get a certain x-ray to make sure that it's placed properly. Now, next we're going to talk about the maintenance of the tube. It's important every time you have a patient with an NG tube, when you enter the room, you want to make sure that the suction settings are proper, and you also want to look every shift at the color, consistency, and the amount of gastric contents you're getting in your canister. You want to make sure it's not too much, and you might have to call the doctor if it is, depending on what the reason the patient's there for. And it's also important every single shift to do what we did before. You want to hear that whoosh of air to make sure it's placed properly, and you want to flush the tube. You want to detach it from suction and flush the tube every shift. Even if the patient's getting gastric contents pulled out of their stomach, it's still important to flush it every shift just to verify its placement and that it's working properly. So in the end, you can see that regardless of if you're getting a tube or if you're placing one yourself, it's important to have education and understanding of the procedure in order to be more comfortable with it, or at least a little less nauseous. Thank you for your time.